Well, my friends, I do like to demonstrate another arthritis case which is known as rheumatoid arthritis. You have already heard and noticed there are different kind of arthritis. One is senile arthritis or degenerative arthritis, which appears after 45 or 50 years of age due to osteoporosis and known as osteoarthritis. You have heard the name cervical spondylitis, lumbar spondylitis, and ankylosing spondylitis are the inflammatory and joint fusion arthritis, which are related to the spines of the body, spinal column or vertebral column of the body. You have heard that only rheumatic arthritis, that is nothing but the myalgia, muscular pain, appears in different parts of the body, rheumatic or muscular arthritis or myalgia. You have heard that psoriatic arthritis due to bad effects of psoriasis. You have heard the gonorrheal arthritis, the bad effects of gonorrhea arthritis develop. Today, just prior to this video, I have given a case of ankylosing spondylitis, which is known as a kind of degenerative arthritis. And in that video, I have elaborately discussed about the difference between rheumatoid arthritis and ankylosing spondylitis. Now I have got a patient of a lady aged about 48 years, a typical case of rheumatoid arthritis. What you have seen in the book, what you have read in the book, the deformity of the joint, different kinds of deformity of the joint is found in the fingers, wrist joint of this lady. So the joint is so stiff, it cannot flex forwards or extend backwards, very totally stiff. So a typical case of rheumatoid arthritis. You have seen in the book, but I am showing in practical of a patient. This is called rheumatoid arthritis. You have already studied that rheumatoid arthritis, a very pathetic, painful arthritis found throughout the world, a common form of inflammatory arthritis. The typical presentation is pain, swelling and stiffness of the joint. The small joints are, especially small joints of the hand, feet and wrist are primarily affects, and the peculiarity is symmetrical. Bam dike hole dan dike, at the same time, in the same place, in the same joints it appears. So first the wrist joint, the ankle joints or interphalangeal joints or intertarsal joints or metacarpophalangeal joints or metatarsal joints, tarsometatarsal joints are affected in symmetrical fashion generally. The pain and stiffness felt by the patient mainly in the morning on waking. As soon as the patient gets up from the bed, he feels this pain and stiffness in severe form, with sometimes splitting edema. So I have shown a typical case of rheumatoid arthritis case. The peculiarity of this disease, it is neither originated from bacterial or parasitic or viral, so no longer considered to be the cause of the disease, although the patient may be suffers enormously. So it has evidently considered that the disease is totally immune, autoimmune mechanism. The current trend goes in favor of autoimmune mechanism and some hereditary genetic factors. Now, what is the pathology of this disease? The synovial membrane and the articular capsule of the joints are mostly affected. The synovial membranes proliferates to fill the joint space a creeping manner and often floats freely into the joints. I have given pictures in many times what happens. The synovial joints, at first they swells, and within the space some fluid enters. This is the basic mechanism of these types of joints. Females below 40 are the main victims. I have shown this gentle lady. This is of course a female patient. So generally ankylosing spondylitis are more common in adult males, but rheumatoid arthritis is more common in females under 40. Intermittent pain and swelling of the joints of the hands and feet are the presenting features, and thereafter the knee joint, elbow joint, shoulder joint, hip joints, one after another may be affected. In the acute stage, the patient may suffer from low grade of fever, অল্প স্বল্প জ্বর থাকতে পারে প্রথম দিকে হলে ইনিশিয়াল স্টেজে, উইথ লস অফ ওয়েট। The finger joints are swollen with typical fusiform or spindle-shaped appearance, and in the later stage, the joint becomes flexed and ankylosed. Fixed হয়ে যায় আস্তে আস্তে। এই জয়েন্টটা যেমন ফিক্সড হয়ে গেছে আমি দেখালাম। So, in short, this is the rheumatoid arthritis. Ultimately, in maltreated cases, the patient becomes crippled. I have seen many patients totally crippled and bedridden not without proper treatment. In allopathic science, there are different types of therapies or treatment: steroid treatment, gold preparation treatment, etc. For time to time, the patient gets relief, and they are trying to discover many other medicines with advancing of their technology and science. In homeopathy, the mode of treatment is the same. Since Hahnemann's time, up to this, treat the patient by totality of the symptoms. And as this is the immunological disease, so the scope of homeopathy is much more than other paths of treatment, because there is no bacteria, no virus, no parasites, a totally immuno-disturbing disease. So the patient as a whole, in the integrated way, in the holistic way, to be treated, and the patient may be benefited, and his or her complaints may be relieved. This patient having symptomatology, stiffness in the shoulder joint, sympathetic in nature, and other symptoms, right-sided aggravations, all considering the total prescription is Hahnemann's tinctura sine acris cali. So I do like to prescribe Hahnemann's tinctura sine acris cali in 50 millisieverts scale of potencies twice in a day for 3 months and let's see the result. I shall share you, my friends, the result.